So I remember March 12th, our CEO called the administrative team in together and said, we need to map out a plan. The state of Georgia, GDOT, Georgia Department of Transportation, was asking us for our COVID plan. It was like, COVID plan? What's a COVID plan? So I'm the first public information officer they've ever had, and I knew this was going to fall to me to write it. So I said, can you get any other plans from any other authorities? Because I have no idea what you want. So the CEO solicited a couple other reports. I got them, and I looked at them, and they were nothing but mimeographed handouts about wash your hands. There was really no definitive information. So we were really starting from scratch, something that was completely unprecedented. We had no idea where this would take us or where we were going to start. Now, the first thing is a lot of businesses shut down immediately because of fear of COVID. But transportation is an essential service. Not only that, in Macon, Georgia, this isn't the kind of authority that transports millennials to jobs in Silicon Valley or in Washington, D.C. or in New York. A lot of our riders are disadvantaged people. They are some of the working poor and non-working poor. They count on us to go for dialysis or to the doctor or to the grocery store or the pharmacy. So there was no way that we were shutting down. So the first thing we started to do very early on was taking our temperature, both for riders and for the entire staff, including the drivers. Nobody was taking temperature at that time. We were really one of the first also. Nobody was calling for masks. And in fact, knowing who our population is, I was reluctant to say masks. It wasn't now where you could get them on Amazon or in the grocery store or in Walmart. Think about the close quarters of buses. Our buses usually paratransit maybe, I think, 8 or 10 people. But for our regular fixed route buses, they hold 32 people plus a driver, or 30 passengers plus 2 wheelchairs and a driver. So we were up against really difficult odds to try to keep everyone safe. So it was very, very important for us early on. The face coverings for our drivers, we gave them to our drivers. We were able to get enough for them, and demanded that everyone have a face covering or mask affixed to their head. Then we had to adjust some other things. We went to a Saturday schedule, which was we kept all the routes, but we abbreviated the schedules. They were a little bit, start a little later, ended a little bit earlier, but we kept the routes because we knew people, they still needed groceries, they still needed to do what they needed to do, but we asked that people did it for essential services when it came to paratransit, which is individual service. We said it's got to be for essential service. Now, when it came to fixed routes, we went free for months. We knew people were struggling. They were struggling to pay rent without jobs. They were struggling to put food on the table. So that was really important to us. And we also started something called Token Transit, which is an app on the phone that allows people to buy multiple bus tickets on their app. This entire time we have followed the science, we've followed the data. Everything we did was driven by the science and common sense and courtesy. And I'm really proud of what we did. Now, I don't know how long we can sustain this, but we're, 8 months in, and we've not had one driver that's had COVID yet, which is unbelievable. I think people who have no other form of transportation are grateful that we never stopped running. People have been so appreciative and so cooperative. We're learning every single day, and we'll continue to apply the science and common sense. And if we see something's not working, we'll change it. If we see we need to strengthen some of our policies, we will. If we see that we can back off safely, that we'll do all of those things.